morning. So for today's return demonstration, what we will be doing is preparing our back table, doing the instrumentation, and the surgical safety checklist. So first, what we will be doing is to drape our back table. So open it. Okay, open and open. Open, then open. So, our back table is already been draped. Next thing we'll do is to peel down the things we will be using. So we have here the glove. So let's just peel it open. Dispose. We have the surgical gloves. Just peel it open. Dispose. And we have here our the drape for the Mayo table. Just peel it open. Okay. So now, in preparation, make sure that you wear the surgical attire. You are wearing your head cap, your face mask, your shoe covers, and then check your hands and arms for any cuts or any wounds. And then, of course, remove all your accessories or your jewelries. And then, if you are wearing nail polish on, remove that as well. So, also we will be opening the seal for the surgical pack. So we have here for the drapes. So let's just open it. We also have here the basin. So open. Okay. And then for the instruments. So okay. The next thing we do is we're now ready for surgical scrubbing. So assuming that we're done with our surgical scrubbing, we're going to dry our hands. So we have here, always make sure that after you've done your surgical scrubbing, always put your hands above your elbow. And then we have here the surgical towel. So we'll just get one. On the first half, we will be drying our first hand, and on the second half, we will be drying the other hand, and then dispose. And then after that, we will now be ready for gowning and gloving. So we have here our gown. So it is folded in a way that the cuffs are here. So for easy wearing, just put your hands on the cuffs. Then okay. So your assistant will be tying the upper back part of the gown, but since we don't have an extra people, so I'll be doing it. So I'll just be tying the back upper part. Now, our front tie should be just as like this. Just we will be tying that later on after we're done with the gloving. So now, we are gonna be doing the close gloving technique. So, of course, it's okay to touch the gown in this part since it is both sterile. So, we have here the gloves. So we're just gonna be doing our gloving technique. Okay. And then we have here our left hand getting the right gloves, and then flipping it over, and then of course do the gloving. So of course my the glove size is much larger than my size, so it's big for me, but it's fine. Let's just fix it later, and then we'll do the same thing on the other hand. So here, we will be, the right hand should be on the outside and the left hand should be on the inside. So we will now be doing the we'll be inserting our gloves. So after that, so we're done with the close gloving. We're just gonna fix it to avoid wrinkling. Okay. And then the next thing, just fix it. Always hands above the elbow, adjust the cuffs, and then, okay, we're done with the gloving. So now, let's dispose this one. And we're done. Okay, so we're done with the glove. So I'm sorry for that because someone entered the room and I can't do anything about that. So now what we'll be doing is to get the shorter tie, and then we have here our assistant. Since I don't have one, okay, can you do it? Okay, and then secure. Okay, so we're done with our gown. So the next thing we will be doing is, of course, to put the drapes on the back table. So we have here the drapes, and then let's just put it here, and then we have the basin. So let's just going to put it here, and then of course our instruments. So dispose this one, since I'll be using this also as mayo table. So I'm gonna be disposing all that, and then we have now here the drape for the mayo table. So we will just be we have here, insert our hands here, and then fold the edges. So we will just be inserting it. Your foot should be on the ground to secure it. So we're now done draping our mayo table. So we have here your surgical towels. We will be placing it here. So, and then another one, another surgical towel, and we'll place it here. Okay, so we're now ready to put our instruments in the mayo table. Let's start first with our towel clip, and then we have the Ochsner straight and the Ochsner curve. We have the bob cup, the Kelly curve, okay, the mixture, the Alice, and then the Kelly straight, and then the needle holder, and the also have here the tissue implant forceps, the surgical blade handle, and of course, the blades number 10, 11, 15, and 20. And then the retractors, the Richardson, Sen Miller, Balfour, self-rotating retractor, and then the Oz, the strips, and then the peanuts. Okay, so we're done with preparing all the instruments. The next thing is our patient is here, so we'll be doing the time in. So greetings. So of course, good morning everybody. Introduce yourself. I'm Kristen Van Banes, the circulating nurse, and other team. I mean the other members of the team would also introduce themselves as well. And then good morning, sir. How are you? Can I please ask for your name? Do you know what procedure is being performed on you today? Okay, and can we check if the surgical site has been marked? Okay, it's marked. And then, did we acquire a consent? Okay, and then, is the anesthesia machine and drug checked? Okay, are there any preventive measures for hypothermia in place? Equipment and supplies checked. Any issues? Okay. Allergies. Sir, do you have any allergies? Okay. Any risk for aspiration? Okay. About blood loss? Do we have any blood available? Okay. After confirming all that, we're done with time. So, of course, the next thing we do is to drape the patient. So we have here the drapes. So okay. So should be like this. Then drape the patient. Okay. And then yet another drape. Drape the patient. Another drape. Drape the patient. And then another one. So we will be using it. So now we're gonna be placing our towel clamp. So we have here our towel clamp. With your hold yung 4 towel clamps on your dominant hand, and using your dominant hand, place it within the drapes. Okay. And then, so we are done. The next thing is put another drape. This is for the incision. So we have here, put it here. So of course, usually we have someone to assist you here, to help you with the with this drape. So okay. So we're done with this part. So we are now before the surgery, of course, we will be moving the Mayo table somewhere where you can access it. So you can ask for help for your assistant. So we will just be moving. Okay. Now the next thing we will be doing is for the um, the timeout. So we have here in the timeout, of course, confirm if everybody is ready for timeout. Is everybody ready for timeout? Okay, introduce yourself again. I'm Christine Van F. Banyas, the circulating nurse. Other members of the team will also introduce themselves again. And then, what's the patient name? The patient name was Christopher Arana. And then the procedure to be performed is amputation of the left leg. And then the site has been marked. And then, are all equipments available? Okay. What is the expected length of the procedure? Any critical or non-routine steps? Okay. And then, is there any patient-specific concern? Okay. Has antibiotic prophylaxis medication been given within 60 minutes? Okay. Are all images being displayed? After that, we are now ready for the operation. So you can see we have here the Mayo table. Then you have easy access on the instruments that you would be passing on to the surgeon. And then, assuming that we're done with the procedure, the next thing we'll be doing is to do the sign out. So we're done with the surgery. So the next thing is to sign out. So confirm again the procedure performed. So the procedure performed was amputation on the leg. And then confirm the label of specimen. And then any concerns regarding equipments and instruments to be addressed. Okay. Are all instruments and sponge counts correct? So any concerns for recovery management? Okay. So after that, we're done with the sign out. Of course, dispose the drapes. Someone would clean it for you, so just dispose it. Then of course, the towel clamps. So make sure that you have checked if the numbers that you have used and not used are correct. And then dispose the drapes. Dispose it. Dispose. Now ask someone to go place the patient to the recovery room. So assuming that the patients have been placed in the recovery room, what's left for you to do is we have here the basin. Make sure that all the instruments used or not used are gonna be put here for cleaning. Okay, so you have assured that all of the sponge, all of the gauze, all of the instruments have been placed here and all checked. So of course we will be doing the cleaning of all these instruments. So assuming that we're done and you have seen that there are some debris left, so remove your gloves, change it, and then do the cleaning of it again. Now, when you're satisfied with the way you cleaned it already, it's now ready for sterilization and for autoclaving. So this would be what for the autoclaving and for the sterilization. So of course the next thing, dispose the drapes. Okay. now, that's it for preparation for back table, for the instrumentation, and for the surgical safety checklist. Thank you.